Hello, my name is Nada Melhem. I'm an associate professor of infectious diseases and microbiology at the American University of Beirut, Lebanon. I'm here today with Dr. Farhan Fazal, an infectious disease consultant from the Sheikh Khalifa Medical City Hospital in Abu Dhabi. Welcome, Dr. Fazal. It is my pleasure to welcome you all to this discussion on practical considerations for COVID-19 vaccination in the Middle East. What we will be discussing today are the following. First of all, what are the benefits and the risks of COVID-19 vaccination? What are the structural and key barriers that prevent people from getting vaccinated? And how can healthcare professionals help to improve COVID-19 vaccine uptake? We will start with the first part of our discussion, and this is the benefits and the risks of COVID-19 vaccination. COVID-19 vaccines have been successful at reducing the severity of the disease and accordingly protecting against increased risk of hospitalization. And we do have multiple evidence from the entire parts of the world. And we do have also as well similar evidence from the countries of the Middle East, albeit they are minimal. We do have studies from Saudi Arabia, from Qatar, from the United Arab Emirates, using different platforms of COVID-19 vaccines. And all of these studies have actually reported the ability of these vaccines to reduce severe disease following COVID-19 infection, as well as hospitalization, and consequently reduce the impact on healthcare systems. One of the most important factors that we talk about when we discuss COVID-19 vaccines is actually related to adverse events. And the most commonly reported adverse events from the Middle East, from data of the Middle East, include dizziness, headache, nausea, musculoskeletal pain, pain at the injection site of the vaccine, fatigue, and fever. And, in most of the cases, the adverse events have been mostly non-serious, with higher incidence in females as well as younger people. Since the beginning of the COVID-19 pandemic, we have observed the evolution of SARS-CoV-2, the causative agent of COVID-19. And this is an RNA virus that continuously mutates and has the ability accordingly to escape the protection from vaccines and immune responses. We've had a number of variants of concerns. We've had the Alpha, the Beta, the Gamma, the Delta, and most recently the Omicron. We will discuss more the impact of vaccination and the effectiveness following COVID-19 vaccines against Omicron and its sublineages, simply because Omicron and its sublineages have replaced all the previously circulating variants of concern. And again, the evidence show that for the majority of the available and administered vaccines in the Middle East, the effectiveness of these vaccines to protect against infection with Omicron and specifically BA.5 ranges between 24% to 48%, and also the protection against severity of disease ranges between 37% to 73%. COVID-19 vaccination, similar to other vaccines, is vital in vulnerable people as well as individuals at high risk. And when we talk about these high-risk individuals, we have in mind children, pregnant women, immunocompromised patients, and elderly. Unfortunately, only around 1/3 of children are vaccinated against COVID-19 in the region. And this is mostly due to hesitancy, due to safety concerns, as well as misinformation about the vaccine. When we talk about COVID-19 infection and pregnancy, we have to remember that COVID-19 infection can increase the risk of adverse outcomes, including stillbirth, cesarean delivery, as well as preterm birth. However, vaccination does not increase the risk of adverse outcomes, but in fact, maternal vaccination against COVID-19 confers protection to pregnant women and their newborns. Immunocompromised patients require special attention as infections are a common cause of mortality. Now, while vaccine efficacy and effectiveness are generally lower, immunocompromised patients were able to mount neutralizing antibodies against COVID-19, albeit requiring further protection and boosting. The same case is the story with elderly, whereby high risk of mortality is detected following COVID-19 infection and waning immune responses. And consequently, we do have to provide this group as well with extra attention. Now, Dr. Fazal, let's take a look at the questions related to the benefits and the risk of COVID-19 vaccination that we've received from our audience. So, Dr. Fazal, people often ask why do they need to get vaccinated if they have already been infected? And also, they know people who have been vaccinated but still became infected with COVID-19. So, how can we help communicate the importance of vaccination to these people?
We need to understand that no vaccine is 100% efficacious in preventing the infection. Ideally, we would want that, but currently the vaccines do not offer that. But the important part is that the current vaccines prevent serious infections and death. And that is what we really want to prevent the overall mortality and morbidity around the world. Now, regarding the first question of if you've already been infected, do we really need the vaccine? The answer is yes again, because as we know, with time, the natural immunity wanes down. And so the vaccine that we are going to give is going to boost up this immunity and help us have an effect of prevention of serious illnesses and death in these patients with newer variants.
I totally agree with you that while this vaccine does not actually prevent the acquisition of the disease, however, the asset of this vaccine is its ability to reduce severe outcomes and hospitalization rates. Dr. Fazal, another concern and or question, if you like, is that people always voice their concerns about the side effects of COVID-19 vaccination. And this is particularly related to specific fears of cardiovascular events. Have you seen these side effects in your practice, and how do you alleviate people's concerns on these matters?
So personally, I haven't seen anybody who has direct effects of the vaccines having the side effects, but literature does show that there are chances of myocarditis with the vaccines. The numbers vary depending on the type of study that they have taken, but a rough estimate is that patients who are male specifically in the age of 19 to 39 have 8.9% or 8.7% per million cases of myocarditis is seen. Now again, if you ask me, have I seen patients who have been infected with COVID infection having myocardial infarction, pulmonary embolism, myocarditis? The answer is yes. And the numbers are huge compared to those that are being documented in literature. If you see studies from China, 8% of patients who have COVID have some amount of cardiac injury. And there have been studies which have shown that COVID itself is a risk factor for cardiovascular outcomes. And hence, the side effect profile of the vaccines is acceptable. Firstly, because it is very less in number. And secondly, the benefits outweigh the risk in a huge way. And therefore, I think this makes sense that vaccines should be advocated. Now, when I describe this to my patients, I give them hard facts, I tell them the numbers, and I show them in graphics. Like, look, if you get infected with the infection, this is your chance of having an outcome. And if you get a vaccine, the chances of you having a myocardial infarction or myocarditis is subsequently much lesser than the former.
Dr. Fazal, we've touched upon the presence of different variants of concerns and sublineages of COVID-19. How effective are the current vaccines against different variants and circulating sublineages? And will this change, do you think, in the future?
Yes. So, as you already mentioned in your previous talk, that the current vaccines are efficacious, but the number is lesser than what you had expected before. This could be partly because of the decreasing immunity as time passes by, or the second part is that the virus is able to evade the immune response or evade the neutralization by the antibodies. Now, the number is less, but it is still effective. That's the first point. Okay. How do we correct this? Is by making utilization of the booster vaccines, especially if they are bivalent. The CDC recommends a bivalent vaccine which has the initial Wuhan strain or the initial strain as well as the newer Omicron strain. Now, what this will do is boost up the immunity, even though if you had a prior infection or you had a vaccination. This will boost the immunity and increase the chances of you not to have a serious event, hospitalization and death. Again, as we mentioned earlier, this might not prevent you from having some running nose and fever, but again, it will be able to prevent serious infections and death. Now, regarding the second question, whether this efficacy will be persistent with time. Now, to answer that question, there is a technical advisory group called TAC-COVAC. Again, the job of these experts is to make sure to study and to keep informing the manufacturer, the important stakeholders about the efficacy of these vaccines against the newer strains. So there are people, experts who are taking care of this and who are constantly watching us and making sure that the vaccines that we are given have efficacy against the current or the future variants that there are possibly going to have.
Dr. Fazal, one other question from the audience is related to the evidence about the protection of COVID-19 vaccine that we've mentioned and we've tackled already in terms of protection against severe disease. However, one interesting question is related to, do we have any information about the long-term effectiveness and the safety of COVID-19 vaccines?
Yes, so the COVID vaccines came a few years back, and so the data is only few years limited. Among the literature that we have got, there are no long-term side effects as of now that has been documented. Regarding the safety of the vaccines, whatever data is available up to date shows good safety of the vaccines, and there is no long-term side effects or malignancies or autisms or anything of that sort that has been associated with these vaccines. Regarding the efficacy of the vaccines, I think we already touched upon that. So we'll not reiterate the same thing that it is efficacious, although the number or the percentage is lesser, and this percentage can be increased by keeping a track of the vaccine efficacy, and there are experts who are taking care of that as well.
Thank you, Dr. Fazal. So we all agree on the significance and the importance of COVID-19 vaccination at reducing the risk of severe diseases as well as hospitalization. And this actually has a huge impact on the protection of healthcare systems in order to continue to provide support to our patients as we go. We next move, Dr. Fazal, together to another part of the discussion on practical considerations for COVID-19 vaccination in the Middle East. And this is the part on the barriers that prevent people from getting vaccinated. We do have data from the Middle East about the COVID-19 vaccination uptake. Again, we do have minimal studies reporting on COVID-19 vaccination uptake, and they are actually wide variation in terms of the percentage of uptake. And we have seen certain countries with 43% uptake, like Jordan, for example, 25% uptake, like Iraq, 74% uptake, like Iran, and 74% uptake like Saudi Arabia, and even 100% and more in the United Arab Emirates. Keeping in mind that the UAE and the Saudi Arabia are among the high-income countries compared to other types of countries that are present in the Middle East. And several barriers and drivers have been affecting vaccine uptake in the Middle East. We do have reports linking the increased likelihood of being vaccinated to being a male, or to being a healthcare worker or healthcare professional, people with higher education as well. There's a link between receiving influenza vaccine, so the likelihood of receiving COVID-19 vaccination is increased also to the increased likelihood of receiving influenza vaccine. And in fact, we had the same results in Lebanon in a study that we performed here actually at the American University of Beirut in Lebanon. Some of the reasons for the hesitancy and thus the low levels of vaccine uptake in certain countries of the Middle East are, again, the safety concerns, the belief that the vaccine is not necessary, and the side effects of the vaccines. And on top of that, the lack of perception that COVID-19 actually exerts a risk on our health. Again, I would like to reiterate that the Middle East has some of the richest and poorest countries globally. And consequently, we do have, as I mentioned earlier, a wide variation in the uptake of vaccines. That's number one. And the access and availability of the vaccines. And this is, again, important because we know from what we have seen during the past 3 years that lower income countries were hit harder by the pandemic, but they still have lower vaccination rates. Dr. Fazal, let's take a few questions on this part of the discussion in relation to the key barriers preventing the uptake of COVID-19 vaccination. One of the most common questions, and I'm pretty sure you've had it before, is that parents say that their child has not been vaccinated, but they have had COVID at least once, and the symptoms were mild. And so, therefore, they don't see how the benefits of vaccination outweigh the risks. What do you say to parents about vaccinating children? And are there any supporting data in younger individuals?
Absolutely. So the question goes back again that after natural infection, do we need vaccination? I think the answer is yes to that. Regarding the need for vaccination in patients who are anyways going to have mild infection. Now, it's important to remind the public that when you say mild infection, it's in the majority of the patient, it is mild, but there are patients who are immunocompromised, children who are immunocompromised, who have autoimmune diseases, who have malignancies, who do have serious illnesses and poor outcomes. Also, there is an issue of long COVID, which is underreported in children as well. The last thing is that even if you get vaccinated, the chances of you having a natural infection, the duration of symptoms is going to be lesser. So therefore, the child is going to be able to go to school more often. Lastly, even if your child is immunocompetent or might have a mild disease, the schoolmate that the child is playing with might not have a good response with the vaccine, and therefore may be at higher risk of developing serious illness. And therefore, it is important for you to be a good team member and vaccinate yourself. Whether all of this can be just given attributed to the natural infection and the patients will not have any kind of serious illness, that's like taking a chance. Nobody can actually predict an outcome of a patient. We have seen this before during the Delta variant as well, that normal immunocompetent males and females aged 28, 30, 32 have died without having any underlying immunocompromised state. So it's like taking a chance. Whenever there's an option available which has shown safety data that is there with not major side effects that have been reported with the vaccine, I think it's important to understand for the common public as well that vaccination gives you an edge and protects not only yourself but also the children that are around and the school teachers who might be immunocompromised.
Absolutely. I mean, the exposure is all over the place, and protecting children will also protect their entourage, including older individuals that are at higher risk of, severe outcomes. So protecting the community through the increased uptake of vaccines among children as well as all age groups is extremely important. You've touched upon, Dr. Fazal, people with comorbidities such as diabetes, heart disease, or obesity, and if they can still receive the vaccine. You've mentioned them a few minutes ago. What would you advise them about their eligibility, and what about women who are pregnant?
So initial trials did not include pregnant women for obvious reasons, but now we have robust data suggesting the importance of vaccination and the safety of the vaccines in pregnancy. Now, all the patients that you mentioned here are the top priority for receiving the vaccination. As per WHO SAGE advisory, which has come, I think, few weeks back itself, they recommend that these are the kind of patients with heart diseases, kidney diseases, diabetes, who are at high risk of developing serious illnesses, and therefore they should be the first ones to get this vaccine, and also they should be the first ones to receive the booster dose. So if there is anybody out there who is part of this group, should receive the vaccine.
Dr. Fazal, another question that we have from the audience is the following. People say that they have been infected with COVID-19 despite being vaccinated. They have doubt about the vaccine and how it works, and they do not see the value of continuing with the vaccination schedule. So what would you tell these people about the value of booster doses? And I know we've discussed that, but it's always good to reiterate.
So the CDC has recommended vaccinations, booster vaccinations with bivalent vaccines, as we mentioned already. Now, from a public health perspective, does it make sense to give everybody, the entire world, the vaccine, knowing that there are still people who haven't received their first dose of vaccines itself? So therefore, from a public health perspective, the WHO has given a top priority, a medium priority, and a low priority, where the countries who are going to give these vaccines can decide based on their infrastructure, based on the availability, and based on the profile of their country to receive or not receive the vaccines. But again, the top priority of the patients who should receive the booster vaccines would be the patients who have got comorbidities. Again, the importance of vaccinating is because of decreasing in the immunity with time, which we have already documents in literature available, and as well as different variants coming up. So this is very, very important to make sure that you convey to the patient that booster doses and keeping up with the vaccines is important to make sure that you are increasing your chances of not having a poor outcome with it, COVID infection.
Dr. Fazal, now that the booster vaccines are being implemented and used, how do you think this might affect future vaccination campaigns? And do you feel that the COVID-19 vaccination boosters may become a regular occurrence or be integrated in other healthcare interventions?
So this is like asking if Argentina is going to win the next World Cup, isn't it? Nobody can predict the future. That's the answer. That's a real answer. Looking back at the data, the way which the CDC has recommended a booster dose with bivalent vaccines, and how influenza vaccines also have a yearly update to them, there is a possibility to this. Whether it's going to be successfully handled or it is really going to be needed or not is a difficult question to answer at this point. And I would want to know your opinion, being a part of the technical advisory group, as to what do you feel regarding this question?
For a successful COVID-19 vaccination, we ought to actually find and think, innovatively across the globe, not only in the Middle East, about tools to really integrate the COVID-19 vaccination with other programs. This is important, in my opinion, for sustainability. For example, certain countries have included COVID-19 vaccine or administered COVID-19 vaccination along with flu vaccines. And this, made a bigger push for vaccines uptakes in certain countries. So we ought to think about how to place COVID-19 vaccines and access to it through, primary healthcare centers, placing it on routine immunization schedules, and so on. And this is, to me, important for sustainability as we move forward. Dr. Fazal, thank you for the insights to this part on the structural barriers and the importance of continuously promoting COVID-19 vaccine. So in this section, we would like to discuss how can healthcare professionals help to improve COVID-19 vaccine uptake. The challenges from influenza vaccination offer good lessons for COVID-19. Influenza vaccination in the Middle East, unfortunately, has been suboptimal, including among healthcare professionals or healthcare workers. And the reasons for the low uptake include the lack of available time, people not being aware of the vaccine, the lack of access to vaccine or availability of vaccines, and the efficacy doubts. Now, influenza vaccination goals, just a quick reminder, are similar for COVID-19. So we have to target the high-risk groups, such as pregnant women and individuals with comorbid conditions. The most stressful component that COVID-19 added to our healthcare infrastructure and the additional challenge to influenza vaccination is the increased burden that it had on healthcare. And of course, we have to think of co-infections that may lead to severe conditions. And so we have a number of components that we have to address in order to actually target misinformation, ensure consistent messaging, and also ensure rollout supporting access. One of the most important components during the COVID-19 pandemic is were the conspiracy theories, that the misinformation. So we have to really address those through continuous education, awareness campaigns, and social media campaigns. We have to mobilize the community to ensure consistent messaging. And by mobilizing the community, we have to involve, religious leaders. We have to involve different layers of our community, empower healthcare workers to advocate for vaccination in order to ensure that consistent messaging about the protection against COVID-19 following vaccination. And importantly, we need to promote the integration of COVID-19 vaccines, like we've mentioned earlier, into other healthcare interventions. And we have to always think and target the marginalized individuals and the individuals at high risks. Dr. Fazal, we have received a number of questions about this part on COVID-19 vaccination, and I would like to share with you some of these questions in order to discuss them together. So as a researcher working with COVID-19, I've always been asked about the value of vaccination. And then I still see that many people are still hesitant about it. Many of them are influenced by misinformation or have false assumptions about COVID-19 vaccine. How can healthcare workers help address these concerns, Dr. Fazal?
Yes, misinformation is everywhere. Some information or information which is not right makes more damage than good. Now, how do we address as a healthcare workers is by education. This also is educating healthcare workers. And now it's the responsibility of the healthcare workers and the common public to put the good word forward. I remember that when the vaccines came out, I myself was scared. So I understand the hesitancy of people when something new comes up. But when there is enough data to suggest, to prove that vaccines are safe and efficacious, people should take that forward. As I mentioned, we have enough data to show that the vaccines are safe. Now, whenever we see something bad, it's our job to make sure that we avoid it or we try to protect the people from it. So I think we should, as healthcare workers, promote this by education. I think the key word here would be education and communication. These two words make a very, very impactful debate and convince the public that vaccines are here to help and not to do any harm as such.
Yeah, absolutely. I totally agree. If we have learned anything from the COVID-19 vaccine, from the COVID-19 during this pandemic, is the importance of continuous sharing of information and updating our communities and the importance of risk communication strategies, actually. And healthcare workers are at the heart of these strategies in order to continuously educate our communities. Dr. Fazal, another question we've received is related to people with autoimmune conditions or immunocompromised individuals who are, ask if they can still take the vaccine. Are there strategies to define how we should be vaccinating these people in terms of vaccine schedule and choice of vaccine platform to use?
Yes. So first and foremost, these are the top priority and they should get vaccinated. Because none of the vaccines, the platforms that are available have live attenuated vaccines, and therefore there is no risk of these patients getting COVID infection because of the vaccines. Now, regarding the schedule of vaccination, anybody who is getting immunosuppressive therapy or specifically rituximab, the American College of Rheumatology suggests that you take the vaccines 4 weeks before your next cycle. Now, regarding those patients who have CAR T cell therapy or bone marrow transplant, it is advisable that you take it after 3 months, so that you get a robust response to the vaccination. Regarding other immunocompromised patients, yes, the chances of you having a robust response is less. Nevertheless, you are entitled for a booster vaccine. And therefore, many countries, especially in the Middle East as well, have documented or have recommended an extra dose of vaccine for these specific group of patients who might have a lesser than required response to the vaccine. So regarding the choice of platform or the choice of vaccine to be used in immunocompromised patients, so there is no specific guideline mentioning that you need to take a particular type of vaccine. You could take any vaccines, and all the vaccines that are out there are safe. There are no live vaccines that you're worried about in these kind of immunocompromised patients. So mRNA vaccines or live attenuated vaccines are very, very safe. And depending on your country and your local guidelines, you should be able to take that vaccine.
While some countries in our region have very high vaccination rates, there remains a lot of inequality in terms of vaccine and resource availability. How can we improve coordination between healthcare workers and other agencies or neighboring countries to enhance access to vaccines and encourage vaccine uptake?
Yes, so the basic issue is inequality in the vaccination that is seen around the region. Now, this is a multi-sectorial or multi-pronged problem as such. On one hand, there are countries where the vaccine is not available itself, even if the people want it. On the other hand, there are countries where vaccine is available, it's also free, but people don't want to take it. So how do we make sure that everybody around in the section, in the region is vaccinated? Now, this will require multiple coordinated effort. What I mean to say by that is healthcare workers promote vaccination, political willingness, the politicians, the patients, the stakeholders make sure that the vaccines are available at a reasonable cost or free if possible, and then education, where the people are educated that whenever there's an opportunity to take the vaccination, they should be willing to take the vaccination as such. But so it's a difficult question to answer, but I hope as we move along and as collaboration across the globe increases, we will be able to achieve this target.
There have been several organizations working to improve access to vaccines such as COVAX. Can you tell us more about some of the work they are doing and what impact they have made so far?
Absolutely. So COVAX is one of the international collaboration center where the idea is to have equitable access. So no matter what your country is financially doing or the number of people that there are in the country, the idea is to have vaccine accessible to everyone around the globe. As mentioned in their website, on the top you would see that no one is safe until everybody is safe. Until all of us get vaccinated, the chances of variants coming up is going to be higher, and therefore even the people who are vaccinated will have a lesser chance of an outcome with the infection. COVAX has been able to do great work in countries. To mention a few, there are a lot of vaccines have been given to Bangladesh. They have done fantastic work in Peru, in Vietnam with the help of UNICEF as well. So there is a lot of collaborative effort of COVAX along with international bodies to make sure to coordinate between the manufacturers, the stakeholders who are entrusted with the responsibility of making sure that everybody gets the vaccine that is required.
Yeah, in fact, this, global partnership has been, in my opinion, successful in many countries all over the world at, trying to ensure the fair distribution of vaccines, treatments, as well as diagnostic testing. We still have, a lot to do because, like we've mentioned, and similar to the certain countries of the Middle East, we still have certain countries that have poor access to vaccines that we need to work at.
Absolutely. Couldn't agree with you more.
Thank you, Dr. Fazal, for your expertise, and thank you for the audience. During this discussion, I hope that we were able to convey the facts about the importance and the significance of COVID-19 vaccines at protecting against severe outcomes and hospitalization, about the importance of promoting a transparent and factual sharing of information, and investing actually in community mobilization to spread the word about COVID-19 vaccines and their ability to protect our communities, and to ensure actually the empowerment of healthcare professionals at also supporting governments to uphold national and global health securities during the fight against not only the COVID-19 pandemic, but also future pandemic and epidemic threats. Thank you again, Dr. Fazal, and the audience for your attention.